All right, Dr. Greg Pat here again, physical therapist from PT Made Simple, and today we're going to talk about shoulder impingement. So shoulder impingement is very common, one of the most popular shoulder injuries that we see. And what it typically looks like is patients will have pain, especially reaching out to the side is very painful. It's usually like around this 90-degree mark, they'll start to get pain, pain reaching forward, and then pain reaching backwards. So pain reaching for a seatbelt, going through a drive-through, reaching out the window, and a lot of times they get pain kind of right in the front or kind of right in the side of the shoulder there. So when you're looking at the shoulder is a ball and socket joint. So if you think of a golf ball sitting on a golf tee, so you have your shoulder blade here. That's the golf tee. And then you have the shoulder or the arm bone called your humerus. Think of that as the golf ball. And then kind of off the back of your shoulder blade, if you feel that kind of bump over the top of your shoulder blade coming over to the side, we call that the spine of your scapula. And that kind of comes over. So it kind of comes across shoulder blade, ends up here, this outside bone. Part of the shoulder blade is called your acromion. So what impingement is when there's a structure that's being pinched between the acromion and the head of the humerus or your arm bone. So it's a very small space, and you have 3 of the 4 rotator cuff tendons travel up underneath that space. So as the arm is coming up to the side, normally the arm comes up, everything's moving properly, and nothing's getting pinched, there's no issues. Impingement happens is as the arm moves up to the side, this is being pinched between the 2 bones, and that's where you get the pain. Usually worse at this 90 degrees. Sometimes as people get past that point, sometimes it even gets a little bit easier. So you have 3 of your 4 rotator cuff tendons that travel up underneath that spot. So you could get a rotator cuff tendonitis, you may have heard that. So impingement, kind of having a diagnosis, doesn't really necessarily say what the true cause is. So you can have impingement means something's being pinched, but it could be one of those 3 rotator cuff tendons. You also have your bicep. So your bicep, everybody thinks a bicep, a big muscle you have in your arm. That biceps tendon travels up through the front of the shoulder, and that also kind of comes underneath this and attaches down into the shoulder, into there. So as the arm rotates up, you can have an impingement caused by that biceps tendon being pinched between the head of the humerus and the acromion in there as well too. In this space as well, kind of above the rotator cuff tendon, but in there you also have a bursa as well too. So that bursa is there to kind of lubricate the joint, but that bursa can become inflamed, and that could lead to another cause of impingement or kind of pain in that shoulder. So when you have a diagnosis of shoulder impingement, pretty much what it means is something's being pinched. So a physical therapist is going to be able to kind of determine whether it's a rotator cuff tendonitis that's causing that impingement, whether it could be the long head of your biceps tendon causing that, whether there could be some bursitis, or whether there could be some other issue like a frozen shoulder or something like that causing structures to kind of be pinched and have limited range of motion. So that's what shoulder impingement is. Pretty much, again, that most common thing we see is the rotator cuff is the one that's kind of being pinched, but usually patients have pain reaching out to the side, reaching behind the back, and the pain is localized to the front or kind of the side of the upper arm. So that's shoulder impingement. If you guys have any other questions about that, leave a comment below. If there's any other video you'd like to know, just leave a comment and I'll be happy to make one. Thanks.